Welcome to HR Voices, real talk with people leaders who are in it every day. We get into the messy stuff, the challenges that keep them up at night, and how they're actually fixing them. No corporate fluff, just smart conversations for people who care about people. HR Voices is brought to you by All Voices, the platform that cuts hours of manual HR work with step-by-step workflows and AI to assist with investigations, performance improvement, accommodations, leave requests, and more, so you can get back to the human side of HR. Welcome to HR Voices. I'm your host, Emily Finnick, and today I get to hang out with Pam Teufel, the CHRO at Mainline Health. Welcome, Pam.
Thank you for having me.
I'm so glad you're here. So Mainline Health is a system of hospitals and care facilities in the suburbs of Philadelphia. Can you tell us a little bit more about your organization, the people that work there, and your role?
Sure. I'm the Chief Human Resources Officer, and in March, I'll have been here 5 years. We have about 14,000 employees, 4 acute care hospitals. We have a behavioral health facility, hundreds of ambulatory facilities, doctor practices. We're about $2.5 billion in revenue. And really, I think are surviving better than most health systems. So we've had actually a couple hospitals close in our market over the last really 5 years. That has really greatly impacted us, but I think we're doing well.
That's good. I also saw you recently received a Lifetime Achievement Award presented by the HR Department of the Year Awards. First of all, congratulations. Your post went viral on LinkedIn. It seems like you have a lot of support. You must be doing something right. Can you tell us a little bit more about, I mean, you don't look old enough to have a lifetime. You have a whole lifetime ahead of you. So that's why I kind of chuckled at first. But tell me a little bit more about what that was like.
So John Toohey and a group of folks that I've known since I moved to the market in 2010 started this really recognition of HR. So there's a Department of the Year award, there's COE awards you can apply for, and really Scott Rosen started it and said, HR doesn't get enough recognition for all the good that they do. Well, one of the other awards they do is Lifetime Achievement. So when he called me, I was like, how old do you think I am? I was like, I'm not retiring. Which he has said to me, they might change it to be called Impact Award.
Yeah.
But I said, sure, I'm humbled. I'm honored, to receive the recognition. I am not close to retirement, unfortunately. So he did say maybe I could win it again in about 10 years.
There you go. Yeah, that was funny. I agree with you, though. I'm not in HR myself, but it's my job to get to know HR people and talk to them. And I think one thing that I hear between the lines, HR doesn't complain quite a bit, but what I've learned is that so much of the role is invisible. Some because it has to be, and some just because HR wears so many hats, right? There's so much that they're responsible for. Could you talk to me a little bit more about the invisible work of HR?
Yeah, so part of it is, one for me was I had a 20-year CEO that was retiring. And so I had to wear the hat of lead the board of directors through an external search. That's not normally something you do. You usually do hiring internally. So that was a whole different hat that I had to wear. We agonize over every decision we make, right? We try to mitigate risk every time we hire and fire, right? We want to do that well. That sounds weird, but you want to do it well so that you don't have risk to the organization. We're dealing with a lot of technology that is antiquated, right? Our health system has wonderful technology in our clinical areas. Our corporate areas are not as strong. And so we have to do a lot of patching, to get things to work. And we really sort of quietly do that behind the scenes and we don't really talk about it. So it is not for the faint of heart is what I say.
Absolutely. Yeah. And if you think about the number of functions HR is responsible for, and you think of the tooling required for each function, and then you think of the connection between them and the context switching, like you can easily visualize this web of data and complexity and process that not for the faint of heart is a good way to put it, right? It's a lot.
Yeah, it is a lot. And this happened probably 10 years ago, and I like technology a lot. And so, people talk about AI, but pre-AI, it was really just every COE You have to know how to drive your technology to get what you want out of it and to make it a delightful employee experience. That's one of the things I push a lot. We like to design technology around us, but we really should be designing about the end user. How do they get the things out of it, or use it simplistically? And in my version, it's so they can get back out on the floor. But you have to understand technology. Otherwise, you're not going to get to AI because you have to have good processes, you have to have good systems, and then you can get to, or can you augment or automate that work?
Yeah, if everything's messy, you're just gonna automate messy, right?
Mm-hmm. Yep. Yep. Garbage in, garbage out.
Yeah. We haven't, I mean, not everything has changed.
Right. Right. Exactly. That's still true. Hmm.
Yeah. I'm curious, I always take the end of the year. We're at the end of 2025 as we record this. I'm curious what's on your mind, what challenges you faced in 2025 um, that are on your mind as we roll into the new year.
And part of what I think I still personally, and then I think our leaders struggle with is, and people keep saying it, but it is the pace of change, right? Like it's nonstop. I had a couple personal things happen this week, like my windshield broke or cracked. My husband got sick, and I got in a little pity party. And then I was like, you know what? You just gotta suck it up and roll with it. Like, but it's really easy to at work say, well, I just can't handle this pace. I'm like, or I like to say, you put your big girl pants on and you just go out there and do it. So there's no rest time anymore, is what I feel like. I feel like it used to be a little bit more cyclical. You'd know you're going to have a rush in the fall. You might have a rush in the winter, but summer's going to be easy, at least in healthcare. It's no longer that. It's a constant push and drive to plan for the next thing and then to evaluate your capacity. And so what I worry about deeply is the capacity of my team, the senior team, and then the staff that are going to do the work, because we do throw a lot at them. And so we just had a call yesterday about a piece of technology that we really needed to put in, but I just said, I don't think we have the capacity to do it. And even though I know everybody wants it, like, I think we have to wait and put it in next fiscal year. Those are difficult decisions that, like, I agonize over. I'm like, because I want to do a lot of stuff. But if I overrun my team, I'm going to burn them out and then they're going to leave. And so I can't risk that. And so sometimes you have to be Captain No, to say, let's wait and plan it. So I worry a lot about capacity.
Yeah, I mean, I'd like to unpack two things you said. The first one, don't let me forget the second one because that's a bad
Okay.
habit of mine. Capacity. But the first one was just the no time for rest. I feel like we're living a little bit parallel lives because I had the same thought last week. I sprained my ankle, car trouble, all the like
Yep.
exact same things. And when one, person in your life or your car, a stable thing you rely on, that your car can get you to point A, point B. When that goes out, I mean, that house of cards can really come down. Like all the meetings, all the pressure, all the things that we're overly committed to. And it feels like I don't have time for my car to break down, but like that happens.
Yep.
It still
Yeah, so
happens.
I
Yeah.
Ubered from we had a potluck today. I signed up for a dish. I was like, why did I sign up? So in the
Yes.
Uber, I had my potluck, and I ended up, the plus was I had a wonderful conversation with the Uber driver. And then I said to myself, see, now wasn't that nice?
Yeah.
Like, you didn't want to do it, and it was really a hassle, but it ended up being a nice moment. We had a nice chat about healthcare.
There you go. It is a mindset. It's easy to quickly go to a place of, like you said, a pity party, but these things have a way of working. I mean, I'm still here. It's Wednesday. We got through it. Do you know what I mean? But the panic that sets in when something goes wrong is not just something felt by us as individuals, but
Yeah.
you represent thousands of people living
Mhm.
lives full of disruption, and
Right.
that point two, capacity, right? Like I think something that leaders often fail to plan for is like the unplannable, not just personal lives, but the things at work that are invisible, right? So
Well,
every project, yeah.
what I like to tell leaders to think about is like, okay, so that happened to you, and how did you feel? So imagine all 14,000 employees. I think a lot about our support services employees who make less than $50,000, right? They all have to have a second job. They can't sustain a livable wage, right, with one job. So they have two jobs. They're on relying on public transportation. Public transportation is late. They're late for work. It's not their fault. The bus was late. And so just consider that they have a harder life, or even if you don't want to give them credit for harder, they have challenges just like you do. Acknowledge when they're walking in the door, they have difficulties. And so I don't think you have to give them 100 breaks, but at least be empathetic, like lead with empathy, be understanding. And like maybe you don't want to rail them if they're 5 minutes late because the bus was late. Like maybe you want to consider, does that matter? Can you accommodate that? And then just move on.
Mhm.
They'll be grateful. They'll trust you more because that's another thing I worry a lot about is I think we've lost a lot of trust in the workforce. I don't think people trust their managers. I don't think managers trust their employees. And when you don't have that trust, that's going to mean turnover. People are just not going to stay. And in healthcare, that really hurts us, right? If we don't have people, patients aren't, you know, signing up for when they'll go in the hospital, right? Unless it's a surgery, they're coming. And so if we don't have staff to take care of them, like we're in big trouble.
Yeah, absolutely. I like the leading with humanity. I mean, it's almost worth it to get everyone together. Everyone share a disruption in your life because we all
Yep.
have them, right? Just
Mhm.
to humanize everybody a little bit. Like
Mhm.
managers aren't out to get you. You're not, employees aren't trying to pull one over. Like, but
Right.
we do. It's almost like a cultural shift that we all kind of operate with
Mhm.
that
Yeah.
suspicious, distrustful mentality. It's really unfortunate because when you get to know a person, rarely is that the case.
Right. I mean, my joke is, people don't wake up and say, I want to get fired today. I do think there's maybe 1% of the population that does. That's my joke that I use, but not the majority. So they want to be here. They want to work. They just might be having something that gets in their way.
I'd love to hear about a little bit more about technology. So
Mhm.
you'd mentioned that some of the systems are a little bit behind and that you're pumping the brakes intentionally because you don't want to overwhelm your team. I commend you for that. Is there anything that you have done that you have prioritized because of the obvious time savings or workflow improvements?
So we use ServiceNow in our shared service center. I do think what I like about that tool is, we've been able to give expanded access to our employees, give them more data at their fingertips. But admittedly, people still struggle to find the answer, right? Even though we have hundreds of knowledge articles, people can't find them. So one of the things IT led, which I was very excited about, and my head of total rewards participated is we did a hackathon and they created a bot for leaves of absence. Now we won the hackathon. So it was multidisciplinary group that came together, but my leader got the credit for it. It was his idea. And it really was just using all the information we already had in a way where an employee can go on, they can chat with this bot. Because we're 80% women in healthcare. And so which is pretty normal. We have a lot of babies. We have a lot of leaves of absence. We have a lot of FML. Even in Pennsylvania, it's not that complicated, but it is complicated. What's going to happen to my job? What's going to happen to my benefits? So it's one of our top questions that sort of bombs out the service center. And so creating the bot to make it easier on employees, give them the answer quicker, let them be calmed down about, okay, what's going to happen when I go out on leave? And so we're in production now. So I think that's very cool. I'd like to do more of that where it's like, look, let's just make it easier for employees to get the answer. Let's also save our HR people from having to answer that same question over and over and free their capacity to do higher level work,
Mhm.
right? I would rather spend time with an employee talking about their career goals and their career development than I would explaining a leave. Now, we'll do it. It's not really value added. It's value
Yeah.
added to that employee in that moment because they need the answer. But if they could get it quicker, because the other piece is no one really wants to call us, right?
Yeah.
They want to text, they want to just go on their phone or email. And when you email, you don't get all the questions out, you don't get all the answers.
Mhm.
So if I can create a bot I want a bot for everything. Give me a chat bot. And I think employees would be much happier with HR.
Well, I mean, I think that's an interesting question of it's really hard and it requires a lot of emotional intelligence to draw the line on what it can and can't answer because most people would say, "Oh, these questions about your future or questions about personal
Mhm.
questions." I mean, there's nothing more personal than having a baby in that
Sure.
moment. You know what I mean?
Yep.
And yet, I think that that's where the emotional intelligence comes in. Is that, however, if your leave policies aren't drastically changing and you're answering the same questions the same way for
Yeah.
every woman that asks you, like
Mhm.
they might appreciate the continuity, they might appreciate the
Mhm.
speed of response. the
Hmm.
thoroughness.
Yep.
Yeah. And also, like, I can't imagine having to answer the same question 1,500 times. Like,
Well, that goes to like, we're trying to attract in our shared service center, college graduates
hmm
into a call center. Let's call it what it is. It's a call center. It's
yeah,
an HR call center. And I love the idea you come in, you learn how to be a generalist, and then you pick which COE you want to grow your career in. But most people would say, well, I don't want that job. That's a terrible job. And so
yeah,
if it's at least a little more interesting, and you could do some higher level conversations with employees, I think you personally as an HR rep would get more engagement.
yeah.
So now I'm keeping it interesting and it's not the same rote work. Now, some people are okay with rote work, but not for more than a year. Most younger folks coming in are going to say, I'm going to do that for a year, but then what's my next job?
hmm I think of my daughter, my son, and the things that they won't have to do.
Right.
The dues I had to pay, and now I sound like I'm 100 years old of like, I used to be in spreadsheets with what, copying
Yep.
cells over, but like that was entry level work at the
Hmm.
time.
Yep.
Entry level work is looking a lot different. Um, and that's a great example from healthcare. Do you have others of just how are expectations of employees changing?
So, I mean, we certainly are tapping into how can we automate work. Like the clinical side, I think is the coolest where, our doctors are burned out with, they call it pajama time work, right? Charting in at night, right? In their pajamas, right? Because they've seen patients all day, they have to go home and chart. Well, that's not great. And so we have ambient technology that, when the doctor's in the room with the patient, I'm a patient. I just went to the doctor and she said, "Oh, are you familiar with our new technology?" I'm like, "Yeah, turn it on." Because it records the conversation and then it will say, "Oh, I heard that you need to order a mammogram, you need to get your blood drawn, and you need an ultrasound," right? So it knows that, it writes the order for the doctor. Doctor gets to review it. Now it's in the chart. That just saved that doctor 10 minutes per patient.
Yeah.
That's beautiful. Radiology, right? Our radiologists have scans to read. Well, I just heard a patient story where one of those scans that looked suspicious got put to the top. The radiologist immediately read it, and that we saved that patient's life, right? Now, would we have still saved the patient's life? Maybe, probably. But what if it was the last scan the doctor read?
Yeah.
So that's where I love what AI is doing on the clinical time. Our nurses do discharge training for patients, right? You're going to be discharged. This is what you need to know. It's boring. They don't like it. It's very rote. And is there a way, we're putting monitors in every room where you can push the button and it shows the patient a lovely video that could then be emailed to them when they go home. Because by the way, when they're in the hospital, they're not going to remember anything anyway.
Yeah.
And they're gonna wake up the next day and said, "What was my PT I was supposed to do?" Physical therapy. And
Yep.
so, like, let's save that nurse literally 45 minutes on average to discharge a patient and have them go do some higher level work. Now, are we gonna get rid of nurses? Our nurses work 12-hour shifts. We're gonna staff those units, but we're gonna free them up so maybe they could sit with a patient longer and
Yeah.
actually just talk to them about how they're feeling, what's happening, what their plan of care is, getting them ready for discharge, like thinking about it mentally. There's so much opportunity that we have. Um, so I love it on the clinical side. We have some nervousness, right? You get a nurse every once in a while. It's like, "Are you trying to take my job?" And it's like, don't worry. Like your job is still going to be there. On the administrative side, like I said with that bot, we're trying to free up the very rote administrative data enter keying into a system. Like
Yeah.
people don't really want to do that work and it's ripe for error, which is what always makes me nervous. If I have to hire new hires and I miskey a social security number, that's not great. Um, so people have said like, well, what does that do to entry level jobs? I still think there's value in entry level jobs. I think we have to just rethink what does that look like, right?
Yeah.
And where are those places where you still are going to bring folks in? It might be different, right? They might never start in a compensation role, but they could start in an HR call center and then work their way up.
Right. Yeah, I mean, I think it's an exciting time to be an HR people leader because of all like some of those use cases just gave me goosebumps. Like I think of AI through the context of, my SaaS job and it's not as it's not as
Hmm.
compelling as some of those clinical use cases.
Yeah.
But what an exciting time to redefine things, right? To really rethink things. It's rare you get that opportunity.
I agree. It is exciting. I think it's just we have to do a really good job messaging the change and working through the change management with those clinicians so that they understand the why, they understand how it's going to help them in their jobs. And then back to my earlier comment, they have to trust that their leader isn't trying to take their job, right? That they trust that they really are pure in their intentions to make their life better. Now, there are health systems that are saying, well, we think now a nurse could take on an extra patient, right? So that's the slippery slope of at some point, if the job gets so efficient, could you see another patient? That's where clinicians get nervous.
Right.
But it is certainly not our intention to do that. We want to get rid of the administrative burden on nurses so they're not burned out, like, period.
Yeah. And the paperwork does that. One of my best friends is occupational therapist, and all I ever hear from her on Monday is my paperwork's due. I can't talk to you right now. My
Yeah.
paperwork, like the paperwork burden is so real in, in
Yeah,
healthcare.
charting for any clinician is a burden, and it does mean they can't see more patients. PT, OT, speech, those we have to block in like certain amount of hours for them to chart. Like, how different is that charting? Now, you have to be careful because the government doesn't want you to just cut and paste
Mhm.
and overbill. That's not good. But on the other hand, like, they're pretty much typing the same thing.
Mhm. Yeah, I look forward to seeing too. I think this will be a year too of where the data gets validated, gets studied a little bit more too. We start to learn more about that
Yeah.
across use cases. Well, this has been an excellent conversation, Pam. I really enjoyed the stories, the examples. I love to ask guests to wrap it up with words of encouragement or advice for listeners.
I would say it's really think I've said this now, I think, for the last year. I give everybody the advice to focus on skill building, right? And your learning aptitude, right? So on the Hogan profile, like, my learning is like an 85. Like, I'm somebody who I'm constantly listening to podcasts, I'm reading articles. I don't read as many books as I should because I don't have time. But like, I am constantly like, did you read that article? Did you hear that? And I'm thinking about how it's going to change work. It's a little obsession of mine. But what I find is when there's employees that just say, no, I learned my job, that's it. Those are the people that are definitely going to be left behind. But the people that, even if they don't have the best skills today, if they're willing to upskill, reskill, learn a new skill, and they're willing to learn, those are going to be the people that'll be successful. Because I have a daughter in college, I have a middle one who's a senior, and he's agonizing over like, what should I be when I grow up? Because is that job going to exist? And I've said to him, like, look, you are you. I had many jobs in my career. You're going to have probably have double the jobs, but as long as you're willing to have an open mind and keep learning, you'll be fine, right? You'll figure it out. Don't worry about it. You're too young to worry about it.
He's going to win his Lifetime Achievement Award at 30.
Yeah.
So,
He wants to be retired at 30. So that's
oh
his
my gosh, that's just youth. I did too. We all thought we were going to make, I don't know what we thought, but
yeah.
well, it's been a joy. Thank you so much, Pam, and enjoy the holidays.
Thank you. You too. Happy holidays.